Hello everyone. Today we will present to you about the marketing ethics in Sanofi Pharmaceutical Company. Sanofi Pharmaceutical Company is a French multinational pharmaceutical and healthcare company headquartered in Paris, France. The company was established in 1973 and primarily focused on the research, production and distribution of pharmaceutical products. Next, let's start by defining the marketing ethics in the Sanofi pharmaceutical industry. It's about adhering to moral principles and standards that guide marketing decisions. This includes transparency, compliance with law, responsible promotion, and respecting the autonomy of healthcare professionals and patients. Next, the importance of ethical consideration in Sanofi pharmaceutical marketing. Firstly, compliance with law and regulations. The company is dedicated complying with all relevant law and regulation, particularly those related to advertising, promotion and communication about their product. Next, Sanofi places a high value on transparency in their marketing practices. This involves disclosing potential conflict of interest and ensuring that promotional materials are accurate, balanced and backed by scientific evidence. Furthermore, responsible promotion is a key aspect for Sanofi. They ensure that their promotional activities don't inappropriately influence research, medical education, policy making or prescribing. It's all about promoting products and services ethically with integrity and in compliance with the law. Lastly, Sanofi respects the autonomy and decision making of healthcare professionals and patients. This includes a commitment to avoiding inappropriate incentive for healthcare professionals. Next, drug promotion and advertising. Evaluate the ethical implication of direct-to-consumer advertising. We will delve into the ethical realm of pharmaceutical direct-to-consumer advertising, specifically examining the case of Sanofi. Let's start with informed consent. DTC ads often paint a positive picture, highlighting benefits while downplaying risks. This can create a skewed understanding, especially for those with limited health literacy, leading to potential misuse. From a utilitarian standpoint, misleading DTC information raises ethical red flags. Any compromise to patient autonomy and informed decision-making can harm both individuals and society at large. Now, let's talk about the doctor-patient relationship. DTC ads could strain this vital bond. Imagine patient requesting specific medication based on ads that will influence the physician. This poses ethical questions related to care theory, emphasizing the importance of relationship and empathy in healthcare. Next, analyze how Sanofi pharmaceutical companies balance the promotion of product with the need for accurate and transparent information. Regulatory compliance. Sanofi, like all pharmaceutical companies, adheres to stringent regulations set by FDA and EMA. These rules ensure that Sanofi's promotional materials accurately and completely represent their products, upholding the integrity of information provided to the public. Next, educational initiative. Sanofi takes a proactive approach by fostering collaboration with healthcare professionals, patient advocacy groups, and educational institutions. This partnership aims to deliver credible and unbiased information about disease and treatment options, bridging the gap between promotion and education. Embracing virtue ethics, this collaboration reflects a commitment to moral character. By engaging in professionals and advocacy groups, pharmaceutical companies demonstrate a dedication to virtue like honesty and integrity, fostering the pursuit of trustful information for public health. From a utilitarian perspective, this educational initiative contributes to societal well-being. By providing accurate information, pharmaceutical companies maximize the benefits of knowledge dissemination, promoting better health outcomes and empowering individuals to make informed decisions. Next, we will focus on the potential impact on public health and consumer trust. First, as for the public health, for the positive impact, accurate information empowers consumers, and initiative by pharmaceutical companies like Sanofi contribute to a better understanding of disease and treatment options. As for the negative impact, there are risks of over-medicalization. Excessive or misleading drug promotion may lead to unnecessary prescriptions, contributing to healthcare expenditures without corresponding health benefits. Next, for the consumer trust, Transparency and honesty in communication build trust. When pharmaceutical companies, including Sanofi, adhere to ethical standards and openly discuss the benefit and risk of their products, consumers are more likely to trust their offerings. As for the negative impact, it will affect on privacy concern, particularly regarding the misuse of personal data for targeted marketing can erode trust. If consumers feel their health information is not handled with care, it may lead to a decline in trust. Next, clinical trials and research ethics. Let's start with crucial aspect of ethical conduct in clinical trials. Informed consent. It's about making sure the consent process is crystal clear. The pharmaceuticals need participants to easily understand everything, includes details about potential risks, benefits, and the key point that their participation is entirely voluntary. Transparency in reporting clinical trials. Report all results, including unexpected findings and unfavorable events, is regarded as best practice to register clinical trials in open database prior to the start. Next is participant safety and data integrity. The company need to establish strict processes for reporting and monitoring safety incidents. Moreover, adhering to good clinical practice, maintain the integrity of our research process, including accurate data collection, recording, and reporting. This aligns with utilitarian theory when the company ensure participants are fully informed through clear and thorough consent, emphasizing the utilitarian goal of maximizing the good for the largest number of people. This also aligns with the right theories when the participants have the right to be protected from harm and the right to contribute to research that maintain its integrity. Next is examine how Sanofi pharmaceutical companies handle conflict of interest in research. Conflict of interest between pharmaceutical companies and the healthcare sector have been a long-standing concern, and they must effectively managing conflicts is essential for upholding research integrity and sustaining public trust. Sanofi, a pharmaceutical company, tackles conflict through strongly adhere to ethical standards. Their policies mandate employees to address and promptly disclose potential conflict arising from personal or professional relationship. Other than that, Sanofi CEO strongly defend the company decision to prioritize research over short-term profit. Despite a negative market response, the commitment reflects a strategic focus on achieving long-term benefits and contributing to scientific advancement. From an ethical standpoint, Sanofi's emphasis on research aligns with utilitarian principle. It is because the company investing in research leads to development of new medicine and advancement in healthcare, contributing to the overall well-being of society despite the short-term financial sacrifice. Lastly, discuss the responsibility of Sanofi companies in ensuring the safety and well-being of trial participants. Sanofi is serious about ethical research and clinical trials. They have a strong system overseen by the Sanofi Biotics Committee to ensure ethical standards in medical activities. They aim to innovate while meeting the highest ethical standard. When it comes to protecting trial participants, Sanofi strictly follows good clinical practice (GCP), a global standard ensuring the ethical quality in clinical trials. This is to protect the rights, safety, and well-being of those participating. To oversee clinical trials, many entities are involved, including health authorities and independent ethics committee. Sanofi adds an extra layer of oversight with its ethics committee, ensuring the protection of participant rights and welfare. In essence, Sanofi put the safety and well-being of trial participants first. Their commitment to ethical guidelines and oversight ensure that research and trials are conducted responsibly. But why does Sanofi focus so much on participant well-being? It's not just about policy, it reflects a care ethics approach. The oversight mechanism, like the ethics committee and adherence to GCP, show a commitment to personal connection and considering the well-being of everyone involved in the decision-making.
Access to medicine and pricing. Number 1. Investigate the ethical dilemmas related to access to essential medicines. We'll explore a challenge the company faced and how they navigated this ethical dilemma. Sanofi Pharmaceuticals encountered difficulties in ensuring access to essential medicines due to the high prices of their drugs. This issue significantly impacts global health as life-saving medications become unaffordable for many individuals. Enter utilitarianism, an ethical theory that centers around maximizing overall happiness or well-being. In Sanofi's case, the crucial question is whether their pricing decisions contribute positively to the well-being of society. So, the company should focus on strategies that bring the greatest happiness and well-being to society. To align with utilitarian principles, Sanofi Pharmaceuticals is implementing tiered pricing models. This strategic move aims to ensure fair and affordable access to essential medicines. Number 2. Pricing strategies and their impact on patient affordability. Next, the high prices of medicines creating hurdles for lower-income individuals to access life-saving medications. To address this challenge, the company proposed a solution, implementing differential pricing for their products. Implementing a differential pricing aligns with the principles of justice by actively addressing differences in access to essential medications among lower income groups. The goal is to ensure that everyone, regardless of their economic status, has fair and equitable access to life-saving treatment. Number 3. Discuss initiatives taken by pharmaceutical companies to address global health disparities. Next, we're spotlighting the pharmaceutical companies' impactful initiatives addressing global health disparities, from collaborating with NGOs to providing discounts in lower economic regions, and a Million Conversations program that invests £50 million to help close the trust gap substantially by 2030. This effort indirectly addressed the global health disparities. The company's approach aligned seamlessly with care theories, emphasizing the moral significance of relationships, empathy, and holistic patient care. In a world where the healthcare goes beyond transactions, this company's initiatives stand as a testament to the importance of empathy and relationships in shaping a more compassionate and equitable healthcare system. Regulatory compliance and industry standards. Number 1. We'll delve into the essential role played by regulatory bodies in ensuring ethical marketing practices. The first subtopic, establishments of guidelines and regulations. Regulatory bodies set the ground rules for ethical marketing. Their guidelines ensure that companies conduct their marketing activities with fairness, honesty, and transparency. The second subtopic is monitoring and investigation. They actively monitor and investigate complaints, acting as guardians for consumers. Penalties are enforced for violations, preventing misleading or deceptive advertising practices, and safeguarding consumers' interests. The third subtopic is promotion of evidence-based practices. Regulatory oversight bodies advocate for evidence-based practices. This ensures that marketing strategies are rooted in systematic, appropriate, and consistent evidence, contributing to the reliability and integrity of marketing practices. The fourth subtopic is ethical theory, utilitarian ethics. Now, let's connect this to ethical theory, specifically utilitarian ethics. According to utilitarianism, decisions are evaluated based on their impact on stakeholders' well-being in the long run. Number 2. Discuss industry standards and codes of conduct governing pharmaceutical marketing. Industry standards and codes of conduct created to uphold honesty and openness serve as a guide for pharmaceutical marketing. Standards for ethical pharmaceutical marketing are provided by groups such as the International Federation of Pharmaceutical Manufacturers and Associations. Some of the requirements are to respect healthcare professionals' autonomy, refrain from misleading practices, and promote accurate information. In order to ensure ethical marketing practices and foster trust among stakeholders, adherence to these principles is essential. Number 3. We're going to explore the contrasting approaches to ethical conduct in the pharmaceutical industry as demonstrated by two major players, Johnson & Johnson and Pfizer. For Johnson & Johnson's adherence, let's start with Johnson & Johnson. The company emphasizes the importance of ethical and responsible conduct, not just as a moral imperative, but also as a business benefit. They commit to maintaining the highest level of integrity in all their operations. Johnson & Johnson is also dedicated to upholding industry standards. They align with codes of conduct set by organizations like the International Federation of Pharmaceutical Manufacturers and Associations, the Pharmaceutical Research and Manufacturers of America, and the European Federation of Pharmaceutical Industries and Association. Moving into Pfizer, which is violating. Now, let's turn our attention to Pfizer. In 2009, the company faced a significant setback with a $2.3 billion settlement, addressing criminal and civil charges related to improper drug promotion. This marked the largest healthcare fraud settlement in history. Pfizer's case serves as a stark reminder that despite having strong compliance programs, violations can still occur. It underscores the critical need for ongoing monitoring, rigorous enforcement of compliance measures, and swift commitment to corrective actions when violations are identified. That's all from our group, and I hope you enjoy the presentation. Thank you and have a nice day.